We've called you all here to talk about a revolutionary new therapy. And before I speak about it, I thought a short presentation will take you through where we stand with it today. Can I have the PowerPoint presentation, please? Failure patients. Did you know that we have a 1 in 5 lifetime risk of developing heart failure, like I just mentioned? And not only that, today it's the #1 cause of hospitalization in the world. The saddest thing about these patients is that quality of life is usually quite abysmal. Over 50% of them will get readmitted to hospitals within 6 months. The mitral valve is the first valve in the heart. It controls the flow of blood in one direction. So the good blood from the lungs comes to the left upper chamber of the heart, and that flows through the mitral valve, and then the bottom chamber pumps it to the entire body. We have several other valves in the heart, namely 4. Statistics have shown that mitral valve disease is at least 2 to 3 times more than aortic valve disease. The aortic valve is the second valve that we've all discussed with all you members of the press, where we talk about TAVI and TAVA. Even in a country like America, in 1 year, 4 million cases of mitral regurgitation are diagnosed, and only 1.5% of them are treated. So it's safe to assume that in India, we at least have 4 million cases of mitral regurgitation every year. Now, this is a nice animation that helps you understand. If you look at, I wish my pointer would work, but I'm going to make do. So if you look at that valve, that is the mitral valve. And the blood normally flows from above downward. But if something goes wrong and the support of the valve tears off like that, blood starts going backward. Now what happens when blood goes backward in the heart? 2 things. Since not enough blood is going forward, the patients get very tired, they can hardly walk. The remaining organs of the body, like the brain, the liver, the kidney, don't get enough blood, produce extreme fatigue. Now simultaneously, a large volume of this blood is going backward. And where does it go back to? If it doesn't go to the body, it goes back to the lungs. So this will flood the lungs with fluid and make the person feel that he is drowning in his own secretions. So this is what happens. So they feel uncomfortable, they can't breathe. The MitraClip is a tiny clip that is actually introduced into the body through the leg, and it is used to clip the mitral valve leaflets together. If you looked at the previous video, you remember seeing the valve that was all flopping around. And look at this video. You can see the tube going up. It's entering the heart. And it looks over the valve from above. So this is the tube in which the MitraClip is introduced. And then the clip moves in. It's bent into position. It's actually opened out like a tiny little clothes clip. Moved under the valve, exactly where the leak is the most. And just pulled up, and the leaflets are clipped together, thereby getting rid of the leak to a mechanical problem. That is why the improvement is so dramatic. Presentation. So I don't know if you all remember, we were here just 3 years ago when we did one of India's first few patients. She was very sick, and her only interest was that she wanted to get back to playing badminton with her grandchildren. And even during these worst few months, we were able to take care of several really sick patients who flew in with severe heart failure. Now this was an 86-year-old gentleman, diabetic and hypertensive, who had a massive heart attack, had emergency stenting. Because the heart attack, depending on which blood vessel it affects, it can affect the mitral valve. So if it is the blood vessel supplying the mitral valve, that area dies off and the mitral valve doesn't work well. He developed a severe leak of the mitral valve. They could not remove the ventilator. They could not remove the balloon pump. And at this point of time, his BP was 80 systolic, and the family shifted him by ambulance to our hospital. Can you see that bright blue color on top? That bright blue color on top is the blood going back up. That is what is called mitral regurgitation. So we took him into a cath lab immediately. Under 3-dimensional echo, you can see how the clip is positioned right in the center of the valve. And you can see the clip arms open in the second picture there. And then, look at this, you can see the clip arms. And you can see how the clip catches the two leaflets. And then the clip is released in place. And look at this, the severe leak on the left and no leak at all on the right. So just imagine, the patient comes in because of the severe leak, blood going backward, filling his lungs, uncomfortable, unable to breathe, not able to maintain pressure. The minute you clip him, there's no leak. Within hours he improves. This is the pressure inside the heart before the procedure, that is after the procedure. This is him 12 hours post-procedure, and after 1 week of being in a ventilator, unable to come off a balloon pump, that is him playing with his great-grandchild just 1 week later. This is how incredible this therapy is. To get all of them in and all of them out of hospital because of the infection control protocols we have. But none of these cases, while they're all special to me, are as remarkable as the patient I brought you for here today. A 41-year-old farmer who's doing extremely well. I am sorry I'm talking about Kameshwar in third person, who's sitting right here with us. But a 41-year-old farmer who was doing extremely well until early of this year, suddenly became short of breath and went to a hospital in Vijayawada. When they examined him, they said that his heart was very weak and he had to rest, and they sent him home. He repeatedly kept getting sick until he could not be managed at home and had to be hospitalized. After spending 1 month in hospitals in Vijayawada, they shifted him to Hyderabad for better care. Even in Hyderabad, they said the heart function had come down very badly. It was only 15%, and that he needed to be on a heart transplant list. While he was waiting for his heart failure became so bad that they could not maintain his blood pressure. And as a last desperate attempt, the family flew him down to Chennai. His heart muscle was so weak that even before we accepted him, we were not sure that we could help him. But the family said, all we want you to do is try. All we want to know is that we did everything possible to make him all right. So we went ahead. About 5 days back, we performed the MitraClip on him. In just 5 days, he's gotten off the ventilator, which was almost a day after the procedure. In just 5 days, he's able to sit up. He's able to walk here without a wheelchair so that he can be present among all of you. And his heart function has gone from 15% to 30%. Now I am hopeful that with careful medical attention, he might even not require a heart transplant. Now the reason why we had a detailed discussion with our surgeons and the remaining groups of doctors and decided to do the therapy is that it was a compassionate process. We just wanted to do a bridge to heart transplant. We thought that medication is not holding him, we'll just clip him so he becomes a little stable till he receives the heart. Even we were pleasantly surprised as to how well he's improved. So he's here. With this, I say thank you so much.
From Apollo Hospitals. Today, I was showing you the patient, Mr. Kameshwar Rao, who was a 41-year-old farmer who had severe heart failure, very low heart function of only 15%, was shifted from hospital to hospital, and he has been on ventilators and ICUs for over 90 days, for over 3 months, and finally came to us. When we looked at him, we found out that his heart muscle had still some reserve, and the mitral leak was so severe that it could be the major component that's making him sick. So after a detailed heart team discussion, we decided to use a new procedure called the MitraClip, even though he's 41, because the volumes were too big. No surgeon wanted to operate. He was not anywhere close to getting a heart for a transplant. So we thought if we clip his mitral valve, he will have a bridge, like some space before the heart transplant. But even within 5 days after the clip, his heart function from 15 has come to 35. He's able to walk and come after 90 days in hospitals and ICUs and ventilator. He was able to walk and come for the press meet today. So this is incredible therapy, and thank you all for coming here to cover this. நான் அப்போலோ ஹாஸ்பிட்டல்ஸில் இருக்கேன். ஆக்சுவலாக உங்களெல்லாம் இன்றைக்கி ஏன் இங்கே கூப்பிட்டேன்னா, ஒரு மிக அதிசயமான கேஸை நாங்கள் இப்போ பண்ணியிருக்கோம். ஒரு 41 வயசு விவசாயி. அவர் வந்து ஒரு இந்த வருஷம் பிறந்தப்போ அவருக்கு தெரிஞ்சிச்சு அவருக்கு வந்து சிவியர் ஹார்ட் டிஸ்ஃபங்க்ஷன் இருக்குது. ஹாஸ்பிட்டலுக்கு ஹாஸ்பிட்டல் போயிட்டு இருந்தார். மாதத்துக்கு மாதம் மோசமாகிட்டு இருந்தார். சடனாக பார்த்தீங்கன்னா அந்த மைட்ரல் வேல்வ், அந்த ஹார்ட்குள்ளே இருக்கிற ஒரு முதல் வேல்வோட பேர் மைட்ரல் வேல்வ். இந்த லீக்கேஜ் ரொம்ப அதிகமாகிடுச்சு. இந்த லீக்கேஜ் மிக அதிகமானதுனால அந்த ஹார்ட் அப்படியே கம்ப்ளீட்டாக பலூன் மாதிரி ஊதி போய் இந்த ஊதுறதுனால லீக்கேஜ் இன்னும் அதிகமாகி ரொம்ப சிக்காயிட்டார். இந்த டைமில் வந்து ஒரு விஜயவாடாலேருந்து ஹைதராபாடு போய் நிறைய ஹாஸ்பிட்டல்ஸ் போயிட்டாரு. எல்லாரும் சொல்லிட்டாங்க எதுவுமே பண்ண முடியாது, ரொம்ப லேட்டாக வந்துட்டீங்க, உங்களுக்கு ஹார்ட்டை டிரான்ஸ்பிளான்ட் தான் பண்ணணும். பட் ஹார்ட் டிரான்ஸ்பிளான்ட் பண்ணோம்னா ரெடியாக ஹார்ட்டும் கிடைக்கல. ரெண்டாவது ஐசியூவில் அவளை வைக்கவும் முடியல. ஏன்னா ரொம்ப ரொம்ப சிக்காயிட்டார். நிறைய மருந்து கொடுத்து வென்டிலேட்டர் கொடுத்து கூட பிபி தாங்கலை. இந்த நேரத்தில் அவங்க வந்து நம்மளை பற்றி கேள்விப்பட்டு இங்கே நேராக அப்போலோ ஹாஸ்பிட்டல் வந்துட்டாங்க. இங்கே வந்த உடனே எங்களோட டீம், எங்களோட சர்ஜிக்கல் டீமு, எங்களோட எக்கோ டீமு, நாங்கள்லாம் உட்காந்து பேசி நாங்கள் நினச்சோம், பாருங்கள் மசில் நல்லா தான் இருக்குது, ஆனால் ரொம்ப ஊறி போயிருக்கு. ஒரு வேளை இந்த மைட்ரல் லீக்கை நம்ம குறைச்சோம்னா அவர் கொஞ்சம் செட்டில் ஆகிடுவார். அப்போ ஹார்ட் டிரான்ஸ்பிளான்ட்டுக்காக வெயிட் பண்ணலான்னு நாங்கள் நினச்சோம். பட் நம்ம அவர் கொஞ்சம் கொஞ்சம் போக போக பார்த்தா அவரோட இம்ப்ரூவ்மெண்ட் அவ்வளோ நல்லா இருந்துச்சு. இப்போ பார்த்தீங்கன்னா நாங்கள் கிளிப்பு போட்டு 5 நாள் தான் இன்றைக்கி நடந்து வந்திருக்காரு உங்கள் மீட்டிங்க்கு. 90 நாள் ஐசியூஸில் இருந்துட்டு இன்றைக்கி உங்கள் மீட்டிங்கு நடந்து வந்திருக்காரு. அவரோட ஹார்ட் ஃபங்க்ஷன் 15லேருந்து 35 ஆகிடுச்சு. நல்ல இம்ப்ரூவ்மெண்ட் இருக்குது. இப்போ நான் கடவுளை என்ன வேண்டிக்கிறேன்னா இன்னும் ஒரு 3 months அவருக்கு ஹார்ட் டிரான்ஸ்பிளான்ட்டே தேவைப்படக்கூடாதுன்னு வேண்டிக்கிறேன்.